1 in 10 people are living with diabetes. However, early detection and treatment is an important step toward keeping people healthy with diabetes. And that's why World Diabetes Day is celebrated every year on 14th of November to educate and spread awareness about diabetes. Hello everyone, this is Anshu Jain from Qatar Day and welcome to yet another significant segment of Qatar Day Presents, the Candid Talk. Diabetes awareness because it matters, brought to you by Home Zaras. And joining me today on this special episode is a family medicine consultant with a special interest in diabetes who has got over 18 years of experience in practicing medicine. He has worked in UK for 11 years before moving to Qatar 5 years ago. Friends, please help me welcome the multi-talented, highly cognizant Dr. Amit Varma. Thank you so much, Dr. Amit. It is such a great pleasure that you've agreed to share your valued time and experience with us. Welcome to the Candid Talk.
The pleasure is all mine, Anshu. Thank you very much for having me on board as well. And thank you very much for your very generous introduction as well.
Completely our pleasure. Doctor, to begin with, I would want to know what's about this World Diabetes Day.
Well, the World Diabetes Day, this is celebrated on the 14th of November each year, and this is to mark the birth anniversary of Frederick Banting, who was one of the scientists who co-discovered insulin with Charles Best in 1922. Mm-hmm. So this is to raise the awareness of diabetes every year, and hence this date.
That's wonderful. I would want to know that how common is diabetes and why and how does one get diabetes?
Okay, well, diabetes is a very impending global epidemic. Okay, it's a silent killer. The numbers are overwhelming. There are more than 460 million people with diabetes in the world as of the 2019 census, and this number is predicted to go further up. More than 700 million predicted in the next 15 years. So we need to do something about it before it crashes.
Yeah, it's going to be really, I guess, awareness is extremely important at the moment.
Absolutely.
Looking at the numbers that you are stating.
Absolutely.
So what are the different kind of diabetes?
Well, as we know, diabetes, what is diabetes? Diabetes is where the body is not able to utilize the sugar, the glucose, what we eat. Insulin is the hormone, which is the reason why people get diabetic, as in if they have insulin resistance, where the body cannot utilize insulin, or they have deficiency in insulin, where there is not enough insulin. So insulin is our currency. Okay, so that is the currency, the lack of which or the less utilization of which can lead to diabetes.
All right.
Okay, now there are different types of diabetes. Type 1, type 2 is the most commonest types of diabetes which people are aware of or have heard of. Okay, type 2 diabetes is the predominant of it. It's about 90% of the diabetes, and it generally occurs in the adults. Type 1 diabetes is more common in young adults and children, okay? And that is due to lack of insulin. Type 1 is lack of insulin. Type 2 is where the insulin production is there, but it's not utilized well enough. The resistance to insulin is a lot more. Okay? Right. 1 to 2% are the rarer types of diabetes. So there are type 1.5 diabetes, type 3 diabetes. So these are rarer types. Those are a small percentage.
All right. So if we see almost both types are almost the same. In one situation, the body is not producing enough insulin. And second case, the production is happening, but the body is unable to utilize it.
That's right.
Right.
That's right.
So what are the common symptoms of diabetes?
Okay. Well, we often talk about the 4 T's in diabetes. Okay. Thirst, thin, tiredness, and toilet. Okay. So I'll just kind of very briefly touch upon all of these. People often have symptoms of feeling more thirsty than usual. Okay, they're losing weight even they're eating what they eat normally. So that's thin. Okay, going to the toilet more often. So passing a lot of urine and more often. Okay, and tiredness, fatigue, feeling tired more often than usual. So these are the common symptoms with diabetes. Okay. Along with this, there can be symptoms such as non-healing wounds, frequent infections, thrush, blurred vision. So these are all the less common, but yes, certainly significant symptoms of people who can present with diabetes. Having said that, 1/6 of people do not have any symptoms when they're diagnosed with diabetes. So it doesn't have to be that somebody has symptoms before they're diagnosed. And that's the reason why we say checks. Even otherwise, if you have a strong family history, if you have a risk, if you are at higher risk for any other reason, you should be checking on a regular basis to identify this early, catch it early, and treat it early.
So that's why we say, at times it is possible that people are diabetic, but they are not aware because it is completely asymptomatic.
That's right. That's right.
All right. So how should or how often should one get checked if they have got a strong family history of diabetes?
Okay. Well, see, type 2 diabetes is a little bit more related in terms of family history. There are rarer types called MODY, which are having a very significant, strong family history of diabetes. So if I have a family history of 2 or 3 generations of diabetes, so if my parents, my grandparents are diabetic, then I need to investigate and look for those rarer types of genetic diabetes, where I would definitely be at a much higher risk. So there is, if I have one of these genes which can predispose me to developing diabetes, then I might even have 95% chances of developing diabetes.
Oh, is it?
So that is eventually what happens. So on the whole, if you have parents, both parents who are diabetic, then there is a 1 in 4 chance of someone being diabetic. But if you have the gene which has the diabetic predisposition, then there is a 1 in 2 chance of having diabetes. So it's important that if you have a family history of diabetes, we need to have a regular checkup annually, at least in the beginning. The American Diabetes Association, they usually suggest after 40 years of age, everyone should have a diabetes check.
Yearly.
Yearly, okay? If your results are negative, then you have a 3-yearly check. Okay? If you have borderline diabetes, then you kind of work onto it, which we will come to it as we speak.
But what is borderline diabetes? You just mentioned about it.
Yes.
Because I've heard the terms like pre-diabetic and borderline diabetes. So what exactly it is?
Yes. Now, this is a very important term. Okay, the importance of pre-diabetes is for us to catch diabetes early. Okay, people in the past used to think, okay, this is only borderline, we don't need to worry about it. Okay, and then we start working once people turn diabetic. But the idea is to catch it much earlier than someone who becomes diabetic. Okay, the reason for this is 6 in 10 people can develop complications of diabetes by the time they are diagnosed with diabetes. So if I'm diagnosed with diabetes today, I might already have, there is a 60% chance I might already have a few complications of diabetes. So it's important to kind of catch it early, catch it in the pre-diabetic phase, so that we can prevent those complications from happening.
The earlier the better.
Earlier the better. So that's why the tendency is to catch it early, treat it early. Okay. There have been figures where about 70% of people who are not treated in the pre-diabetic phase end up with diabetes. Okay, and 34% of the population are already pre-diabetic. So if you actually check everybody in this world, you might have 1/3 of them who are in the pre-diabetic range. So that's a scary number.
So we should often get checked, and that's the only way, I guess. So what are the tests that are needed to diagnose diabetes? And at the same time, if I know that I'm diabetic, in that situation, how often should I be seeing my doctor to optimize the diabetes management?
Yes. Well, this is very important. See, the normal test which people do is fasting blood glucose. Okay, so you go on an early morning fasting glucose, fast overnight 8 to 10 hours, and then have your blood glucose checked. The values are usually less than 100 are supposed to be normal. 100 to 125 is the range of pre-diabetes. 126 plus on 2 or more occasions is suggested to be diabetes. Okay. Now it's not new. It's been for many years. It's a term called HbA1c. I don't know if you've heard of this. This is measuring not a snapshot of your sugar. Okay, fasting glucose is measuring my sugar today, this morning, but HbA1c is measuring the average of my glucose over the last 3 months. Okay, so this is like checking the mileage of your car. Okay, so you have your empty tank, full tank, and then you run the car through and check the mileage. So that's a better way of depicting how you kind of diagnose your diabetes and how you follow through and monitor your diabetes management.
Exactly.
So in terms of HbA1c, the cutoffs, 5.6 of HbA1c is normal, so less than 5.6. 5.7 to 6.4 is pre-diabetes. 6.5 and above is diabetes.
So it is basically not measured just on your current day's glucose or sugar intake. It's the averaging of your past 3 months entire glucose level of your body.
That's right.
Right.
So coming to the second part of your question, which was how often should you be seeing your doctor? Now, it depends on how and what your levels are. So if my HbA1c is in the pre-diabetic range, I would like to see my team every year. Okay, to keep a tab of it, work on it, manage it in the most efficient manner. If my diabetes levels are higher up, then I need to start seeing them more often. Most of our patients, we have a check at least biannually. So every 6 months we do a check and then follow through. If they are well controlled, then we kind of go down in terms of the number of checks needed.
Right, but they need to monitor their sugar levels, I guess, on a day-to-day basis at home.
Yes, well, that is an important question. It's a very important question. I have a lot of patients who come to me with these pinprick tests saying that my sugar levels are up and down, up and down. Now, this is not necessary for everyone. Okay, if someone is diabetic, there are on different types of medications. Okay, a few of these medications can cause hypos. Hypos is where your blood sugars go down. Okay, these group of patients who are on such medications need to monitor their sugars on a regular basis. People who are on insulin, they are again prone to having low sugars, which is more dangerous as well. So those people are advised to monitor their blood sugars at home on a regular basis. But there is a vast majority of patients who are not on any of these medicines, and they really don't need to be monitoring it on a daily basis. The reason I flag this up is a lot of cost implications. There is a lot of people out there who cannot afford those testing strips on a daily basis. It is very expensive, and to do that 3, 4, 5 times a day it really adds on to the costs.
True.
So hence it's important to know which is that group of people who need proper checking, and who are those who can do it once in a while times.
Once in a while, so that can be done after discussing with the doctor.
Absolutely, it's very important to bring this up with your diabetic team when you discuss your diabetes, and then work on it accordingly. Otherwise, when you have your clinic visits every 6 months, you have your blood tests, you have your fasting sugars, you have your whole random tests done, the whole panel of your tests done, and that would hopefully tell us what your average is over the last 3 months, and we take it from there.
Okay. So it's extremely important to be in touch with your doctor regularly and get the appropriate knowledge of what has to be done and what has to be avoided.
Absolutely,
Right.
absolutely.
We want to know that how does one's weight affect the risk of developing type 2 diabetes? Since we have heard the term diabesity. So what is this basically?
Yeah, thank you for bringing this up. This is a very, very important subject. It's a very relevant topic today at the moment. Diabesity is a combination of two impending epidemics which is ongoing. Okay, diabetes and obesity. So hence we call it diabesity. Okay, the reason for this is because obesity gives you 80% risk of developing type 2 diabetes in the next 5-10 years. Okay. Now, people who are obese are obviously at more risk of diabetes. If we talk about the Qatari population where we are at the moment, 17% of the population, the Qatari population, are diabetic. Okay. In terms of obesity, if you look at BMIs, I'm sure you're aware of BMI cutoffs. Less than 25 BMI would be normal. 25 to 30 would be overweight. More than 30 would be obese. Okay. So in the Qatari population, we have 70% of people who are already overweight, and 40% of them are obese. They have more than 30 BMI. Okay. So this is a big risk, which is kind of pushing people towards the epidemic of diabetes.
But doctor, here's one confusion. You just mentioned some time back that if people are diabetic, they tend to lose weight.
Yes.
Now, another part we are discussing that obesity,
Yes.
it leads to diabetes.
That's
You know,
right.
people who are obese are more prone to diabetes.
Yes.
So, don't you think it is a kind of contradiction? So, what's the point here?
Well, what's happening here is somebody who is obese is more prone to develop diabetes, and once they start developing diabetes, they might start noticing that, "Oh, I'm losing weight. What's happening? I'm not doing anything out of the blue. I'm eating what I've always been eating, but still I notice I'm losing weight." So that's where you start triggering your red flags and start investigating to look for diabetes. But obesity itself is predisposing one to develop diabetes.
Okay, so you are obese before and then you tend to lose weight later once you are diabetic. That is how.
So it's unintended weight loss. So weight loss with me going to the gym and dieting and working on my diet and lifestyle is different to unintended weight loss. And that's where you start worrying and looking at the red flags.
Okay, all right. So having said that, so is diet management or lifestyle management a natural way to cure diabetes?
Well, this is a very, very important one again. This has been pushed from donkey's years, okay? Diet and lifestyle. See, we humans are not made to sit on a chair. We need to keep ourselves walking around. We've been given 2 legs to keep ourselves moving, okay? You see animals moving all the time, just sitting and doing nothing. And that is the very important part of preventing this diabetes, okay? So we want to get people being more active. We want them to work on their diet and lifestyle. We want them to work on the general advice is at least a minimum of 150 minutes of exercise, of active exercise a week. Okay, so you kind of work on this. Start gradually. When I see my patients, I tell them start off with a 10-minute walk 3 times a day. Slow and steady. Build up into it because you need to develop this, inculcate this in your lifestyle. It's not a 1-day, 2-day thing. It has to be something which you follow through and you make this as a habit. Okay. So once you start working on your physical activity, again with the physical activity, we are talking about exercise, we're talking about aerobics as well as strength muscle training exercises. So it has to be a combination of both. So 2 days a week you do this, 2 days a week you do this. And that helps to improve insulin sensitivity. When we spoke about type 2 diabetes, the insulin is there, but it's not utilized by the body because of resistance. So the key is rusty. Okay, we want to polish the key. And the way of polishing the key is keeping ourselves fit and active. And that makes your insulin more sensitive and it starts unlocking all your cells. And then we start utilizing the glucose in a more efficient way.
Okay, so exercise is of utmost importance. It plays a vital role.
Absolutely.
In treating and curing diabetes.
Very
Having
much
said that, is it possible to treat diabetes naturally via exercise management, diet management, lifestyle management?
Yes, talking about that, again, one big chunk of your management is your diet, isn't it? So we often suggest a plate meal. It's an easy way of managing. A plate meal is where your portion size is to be reduced. Okay, you reduce your portion size. Instead of your bigger plate, take a 9-inch plate. Okay, you divide your plate into 1, 2, 3. Half of it is supposed to be fruits and vegetables. 1/4 is lean meat or lean protein, beans, soya, any of that. Okay, and another 1/4 of it is supposed to be grains. And grains, I mean, it's supposed to be. It's better to have whole grains, something on the sides of brown pasta, brown rice, chapati, something of that sort. Okay, so if you divide your meals in that way, you're working less on refined sugar, you're having less starchy carbs, and more proteins, more salad, and that's going to help one side of it. Okay, on the other side, you keep yourself physically active. And if you start working on this early in diagnosis, so if I'm diagnosed with diabetes today, and if I'm in the first year of my diagnosis of diabetes, and I start working on this aggressively, then there is a very good chance of me reversing my diabetes. This is again a new thing where we talk about reversing diabetes or going into remission of diabetes. The earlier we treat aggressively, the more are the chances of someone getting into remission of diabetes. Okay, the later we leave it, the more complications start developing. As I mentioned earlier, 6 out of 10 people might already have complications at the time of diabetes, at the time of diagnosis of diabetes. So if they're already diagnosed with diabetes, they already have developed a few complications. We want to prevent that. So treat early, manage early, and try and reverse if you can.
That's why I guess we say that type 2 diabetes is reversible. Probably that's a point, right? Okay. But doctor, I would want to ask one thing here. You just mentioned about consumption of natural foods, natural sugar, right? But if I'm not mistaken, we are told, to abstain from sugary items and products. So that way I'm consuming fruits and all. Is consumption of natural sugar all right? I mean, can we do that? So Or does that mean that I have to completely abstain myself from my favorite food items? That is the case.
Absolutely not. Absolutely not. See, someone who is diabetic, the way of managing in terms of that has completely changed in the last 15, 20 years. The advice now is you can absolutely eat what you like in terms of fruits and vegetables. Yes, we advise avoiding refined sugar. Yeah, avoid diet cokes, avoid sodas, avoid your canned drinks. Okay, so that sugar is not good. Natural fruit sugar is absolutely fine. So you cut down on the quantity of it. Okay, if you really love mangoes, having a mango once or twice a week is absolutely fine. But yes, we try and say cut down on mangoes and melons, which are high glycemic. Go towards more low glycemic fruits. So bananas are fine, apples are fine, pears are fine. So there are fruits and vegetables, absolutely. Any vegetable, most of them, apart from starchy vegetables, are absolutely fine to go.
Okay, so it is not a compulsion to completely cut down all those fruits and vegetables which has got a bit of sugar content.
Yes, true.
All right. Okay. Now, I'm pretty sure that all the medications that we take, they have got some side effects. So, what are going to be the side effects if I'm on insulin or any kind of medications which are related to diabetes?
Yes. Look,
do they have any? I would want to know from you.
Of course, see, even paracetamol has side effects. So every medicine will come with its own list of side effects, isn't it? So now, when we talk about management of diabetes, type 1 would be different to type 2 when we start managing people with diabetes. Okay, talking about type 2 first. Type 2, we would start them on, yes, I usually give them a 3-month go with diet and exercise if they're very borderline, very early on it, and see how that is responding and how their sugars work on with their lifestyle management. Okay. If not, then my first step would be starting medicines. We usually have a foray of medications. Previously there used to be only 2 big classes of medications for diabetes, but now we have a long list of medications of different classes which work in different levels to help prevent or treat diabetes. Okay. Now, metformin, people might have heard about this, is a very commonly used drug. It is still the gold standard. We still start at diagnosis or in the first few months of diagnosis of diabetes because it helps to improve insulin sensitivity. Okay. Now, most people who start it, they might feel a bit bloated. They might feel fullness. They might have a bit of irritable bowel, which is common with it. But if you give it a go, if you keep going with it, usually a few weeks down the line, these side effects tend to settle down, and then people start noticing the good effects.
Okay. You get used to it.
Yes, the body tends to adjust to it. So that usually settles. 9 out of 10 settles. 1 out of 10, yes, it doesn't. And then you have to change and try different managements. Now, when I was talking about other medications, there are other medications which improve insulin sensitivity. There are medications which help to stimulate the pancreas to produce more insulin. There are medications which work on a hormone called incretin in the gut, which helps to improve the sensitivity again of insulin. There are now new medications which help to pass more sugar in the urine. Okay. Now, diabetes going back in 1550 BC, it was mentioned in the Egyptian papyrus, the first mention of diabetes. In Sanskrit, in Ayurveda, 5th century BC, they have mentioned about madhumeha, sweet urine. That is how they tend to diagnose diabetes in the earlier days. So the newer class of medications now is making your urine more sweet. It is making you wee out the excessive sugar which we don't need. Okay. Now, these are all very good medications, but of course, we need to watch out for medications related side effects which might cause problems with the kidneys, with the liver, any of those. But when we start these medications, we discuss this with the patients. We see what is best for that patient and we start them accordingly. So it's important to have a regular follow-up with your doctor and discuss these things when you are started on medications. It's important to know what you're dealing with. Okay. Talking about insulin. Now, insulin is a completely different ballgame, isn't it? It's a definite requirement in someone who's type 1 diabetic because they don't have insulin. The pancreas is not producing insulin. So they need insulin to keep them going. Okay? In type 2 diabetes, if they're not controlled well enough over a period of years. Now, there is a lot of study and data which shows people with type 2 diabetes, 6 to 7 years down the line, end up needing insulin. Okay? There's a lot of phobia about insulin. People get scared. Oh God, I don't want insulin. Insulin is a killer. It's the end of the world. It's not. Okay? The idea is if you get in insulin earlier, when it's necessary, you're going to help manage your diabetes better and you're going to help prevent complications, which is the biggest reason for people to end up with problems due to diabetes.
So we can say that it is a life savior. That's how it is, right? Doctors, some women tend to develop diabetes during their pregnancy. I would want to know, why does that happen? And is it risky for the women and the baby?
Yes.
And at the same time, what are the chances that that particular woman is going to be getting diabetes all over again in the future as well?
Yes, well, this is a very, very important question. Okay, someone who has risk factors of diabetes, they have a family history of diabetes, if they are obese, they have a sedentary lifestyle, they are at a higher risk of developing diabetes. Okay?
During pregnancy?
During pregnancy as well. Okay. Now, in pregnancy, what's happening is your insulin, the hormones of pregnancy is making your insulin resistance go up. And that is the reason why some people who are predisposed to diabetes develop over diabetes in pregnancy, and that's called gestational diabetes. Okay. Now, these people, they need to really be aware of it, catch it early, manage it early, because there are risks. As you mentioned, there are risks to the mom, there are risks to the babies. There are 1/5 of preterm births happen in gestational diabetes. Half of kids might be more than 4 kilos of birth weight with diabetes, and that can complicate the delivery. Okay, so there is risks involved, and hence we keep the levels much lower than in someone who is diabetic but not pregnant, because we don't want them to be even in that pre-diabetic range. We tend to treat them earlier. But yes, if you are planning, if somebody is diabetic, or if somebody is at a higher risk of diabetes, they talk to their doctor before conception. We advise them to talk to their doctor before conception, so you can plan your pregnancy. So you plan your pregnancy to avoid the side effects or the after effects of what might happen if the diabetic gets complicated.
Okay, so it is extremely important to get yourself properly checked before you apply.
Yes, and if you're already developed gestational diabetes, then you manage it accordingly and aggressive.
Yeah, but it is not a compulsion that the baby is going to develop during the birth itself. The baby
Not necessarily. Well, neonatal diabetes is very far and few between. Yes, it's documented, but very far and few between. But yes, somebody who has had gestational diabetes is at higher risk of developing diabetes in later life. So that is your second part of the question.
Yes, exactly.
So if I've had gestational diabetes, I need to keep checking my sugars annually after I have delivered. So every year I need to see my doctor and get a sugar test done, because I want to make sure that I'm not getting into the diabetes.
All over again. Yes. Okay. Now, what are the long-term complications of diabetes? What are the key points that I should be cautious about?
Yes, this is the highlight. Diabetes itself is a silent killer, but the real killer is the complications of diabetes. 80% of the budget, over 10 billion every year spent in the UK, for example, is to treat the complications of diabetes. Okay. Now, type 1, type 2, slightly different, but yes, there is a lot of overlap. Okay. Type 1, the main thing to worry about is something called diabetic ketoacidosis. It's called DKA. Okay. This is when there is an acute lack of insulin. Okay. And children especially, they present in a DKA situation in hospital. And most of them, 25% of kids are diagnosed with type 1 diabetes for the first time with that presentation. Okay. Now, this is where ketones in your bodies is going up, and this can cause acidity, a lot of acidic in the blood, and that can develop complications and even death. So that's a real red flag for type 1 diabetics to be aware of and keep an eye on. Okay. Hypoglycemia, again, is a very common side effect. I wouldn't say it's a complication, but if someone on insulin has to be really aware of it, because this is another killer, especially in the elderly. Okay, so you need to manage and check your sugar on a regular basis and make sure you're not going too low. Okay, coming to your complications, your long-term complications of someone who's diabetic. Now, why do we see our doctors or your diabetic teams every 6 months, every year? The reason is to catch your complications early and treat it early. Okay, so if you talk about ABCs of diabetic, okay, people might have heard of this. ABC. A is A1C. Okay, so HbA1c control. So that's a target. You want to keep it less than 7 or 7.5, depending on where you are in your diagnosis. B is blood pressure. Very important to monitor and manage your blood pressure. We usually keep a target of 140/90, but somebody who's having poorly controlled diabetes or kidney problems because of it, we tend to have a lower blood pressure threshold, 130/80, depending on the patient. So it's a very individualized care.
Right.
C, cholesterol. Okay, cholesterol is a very important thing to notice and keep it at bay, because this in combination
It leads to
a lot of risk. So people with diabetes are at high risk, at 2.5 to 4 times higher risk of developing heart failures, heart attacks, and strokes. And these are killers. Okay, so we need to prevent that by treating your ABCs. And when I say ABCs, there is an S associated with C, and that is you stop smoking. Okay, smoking, cholesterol, high blood pressure all lead to thinning of your arteries, excessive plaque deposition, and that leads to strokes and heart attacks. Okay. Now, having said that, long-term side effects again, kidney problems. Okay, diabetic nephropathy is what we call it. Diabetes can affect your kidneys. Okay, it's a leading cause of people on dialysis because of diabetic end-stage kidney disease, and this happens if you have uncontrolled diabetes for a long time. Okay. Same with your eyes, retinopathy. So diabetes, high sugar over a longer period of time can affect the back of your eyes, the retina. Okay. When I see a doctor, every year I need to also see an ophthalmologist, the eye doctor, because I need to scan my retina. Okay. Every diabetic should know this. It's very important. He scans the retina and identifies any early changes of diabetic retinopathy and treat them early. Because again, this is one of the leading causes of blindness in the developed world. So you need to treat and prevent this from happening. Okay. Number 3, nephropathy, retinopathy. Sorry, I'm talking about neuropathy. Neuropathy is where diabetes over a long period of time damages your nerves. Okay. So people get tingling, people get numbness, they lose the sensation of their feet. Okay. If I trip over something, I got a small ulcer, a pinprick, a thorn prick on my foot, I know it straight away because of the pain.
Yes.
Diabetics tend to lose that sensation.
Okay.
So if you lose the sensation, that small prick can develop an ulcer. The ulcer can get infected. It can develop a gangrene. The tissues can start dying around it. And the diabetic person might not even notice it until it's too late. Okay? And hence, diabetics, foot amputations is one of the leading causes of mortality, of death in diabetics. Okay. So that's the reason you need to kind of be very aware of it.
Yes.
So nephropathy, kidney, neuropathy, nerves, retinopathy, eyes, of course, heart failure, heart attacks, kidney problems. All of these are long-term complications of poorly controlled diabetes. So when you see your team every 6 months, every year, you have these annual checks.
Right. I guess that is why it is being told that you should be extremely cautious, or especially you have to be taking care of your food in particular, if you are diabetic.
Correct.
Right. If I'm not mistaken, it leads to memory loss as well.
Yes.
Dementia.
There's a mention of type 3 diabetes where there is insulin resistance in the brain in the elderly, and that can lead to dementia and Alzheimer's. So there's a lot of research and study going on about this as well. So something to watch out for.
So I guess this is one of the very important factors that people, they tend to ignore, but it is extremely important to keep yourself properly checked on a day-to-day basis, because one problem developing in your body might lead to multiple more, and we are not even aware of that.
Exactly.
So the key to it, precaution is better than cure. At the same time, getting yourself regularly checked, I guess that's
precaution, prevention, that's the key.
That's true. That's true. Very true.
Certainly.
Now, doctor, we have heard that diabetes management overwhelms people. It often leads to depression. Is it true? And how should one be dealing with it, basically? Is it true?
Very much. It's a stigma. Thank you for bringing that up. It's very important for people to be aware of. Okay, depression is twice as common in diabetics than in the normal population. Okay, so it's very, very common. Diabetes, if someone is diagnosed with diabetes, it's not just a one-off condition. It's not like a chest infection. I take a course of antibiotics and I'm done with it. It doesn't work that way. It's a lifelong condition. I have to live with it. A person with diabetes has to live with it. Okay. Now, there is depression and diabetes, which are separate entities. It's depression caused by diabetes, which is another separate entity. Okay, they're two separate entities.
Yes.
They have to be treated separately. But it's very important to acknowledge this. Okay, so anytime a person, a diabetic, is seeing their healthcare professionals, we tend to bring this up. We ask about how they're feeling. What is their day-to-day life like? How do they manage their lifestyle? How do they manage their diabetes control? Because diabetes burnout is what happens with people who are having long-standing diabetes, and they start developing depression due to it, and then they start neglecting themselves. They start not managing their medicines, they start neglecting their health. They've had enough. Okay, and that's really important to acknowledge and catch, so that we can address this situation early, start them, get them to a counselor, medications if they need be, but work on it.
Work on it, right? So depression has to be treated parallelly along with the management of diabetes.
Absolutely.
Doctor, you just mentioned that one has to live with diabetes for life. Does that mean that it is not curable at all?
I mentioned about remission of diabetes. Yeah, as we said, there is a lot of entity now where we can say that people can be into remission. The reason we say remission or not cure is because we don't know yet. There is a lot of research going on yet. Okay, if you catch it early, if you treat it early, there are much higher chances of you being into remission. Okay, and we call it remission because we still keep them on annual checks, because we want to find out if they are coming back into the diabetic range. And this is again dependent on the patient's lifestyle. If they develop the attitude of modified lifestyle and continue with that, then that will keep them at bay. Okay, so remission of diabetes really helps to prevent complication, prevent deaths, and helps people manage it much better. Okay. Having said that, with type 1 diabetes, there is a lot of research now with artificial pancreas. There's a lot of research with islet cell transplantation, and all of these are producing insulin, which can then contribute to your lack of normal insulin. I don't know if you can call it a cure again, but it's certainly looking interesting. I think the next 10, 15, 20 years is going to be very, very interesting, very, very different in terms of managing diabetes.
Correct. So we can't say that it can be completely cured, but we can certainly say that yes, it can be completely managed.
Absolutely. See, I didn't touch upon bariatric surgery. Okay, when we talk about obesity, now people who are morbidly obese, if they have a BMI of 35, 40 plus, they are classified as morbidly obese. Okay, these people tend to have a very poorly controlled diabetes, irrespective of what they do. Okay, in this group, there's a very selective group. Bariatric surgery has shown to reverse their diabetes, shown to get them into remission. 30-40% of them have been in remission even 15 years down the line. So it's a very interesting field, but certainly a way where you need to kind of look forward to, discuss with your medical team. It is individualized care, but it's doable.
Right. So the future is bright.
Certainly
bright something
if we
is
work
going to
on
come
it.
up. Yes, right. Now, one advice or one suggestion that you would want to give to the family member, parents of the person or people who are diabetic, what kind of support should they be extending to the family members at home who are diabetic?
Yes. See, it's a very interesting one here, because diabetes is not affecting just that person. It's affecting the family. Okay. It affects the way the family is working. Okay. So if I am diabetic, I would not be alone in it. I would need support of my spouse, my kids, my parents to work on, because you can't have one person having a highly sugary tea and Coke and everything else, and everybody, it doesn't work like that. It has to be a team effort. Okay, so that is really, really important. Having said that, diabetes is not the end of the world. A diagnosis doesn't mean it's the end. Okay, it's just a condition as anything else is. It's something which you can work on. You treat it early. There have been lots of celebrities. I'm sure you've heard of Tom Hanks. You've heard of Halle Berry. You've heard of Elvis Presley. You've heard of Kamal Hassan, Fawad Khan. All of these guys are diabetic. They're celebrities, but they're diabetic. And look, and they're doing well.
Yes. That's how it is not the end of the world.
Absolutely.
Doctor, one confusion that people carry in their minds is that diabetes is communicable. Is it true? And at the same time, I would want to add on one more thing. If anybody is diabetic, does that mean that they can still have a family life and carry on with all the activities like normal person, like others too?
Absolutely. See, that first part of your question, not communicable. Diabetes does not touch by touching. It doesn't spread that way. It's not communicable at all. So that stigma, that myth has to be taken off. I'm sure with awareness, with education, people are getting more and more educated now, and they know that it is not. I'm hoping that this continues to get better. Okay. Second part, yes, they can lead an absolutely normal family life. There is nothing stopping them. As I mentioned about the celebrities, they're doing fantastically well.
Exactly.
Yeah? So we need to be inspired and just work on it. It's something which will help us move our lifestyles to a healthier option. So you should take it as an inspiration. You should take it as, okay, this is kind of giving me a kick. Okay, I need to work on my ways. I need to start
lead a more healthy life.
Absolutely.
Right. Wonderful. So there is no harm in having a family or starting a family life, planning something like that, and they can carry on with all the activities. Nobody needs to abstain or refrain themselves from doing anything. That's
not at all. Not at all. As far as you're doing it in moderate limits, you're absolutely fine. Talking about family, I'm sure people are not. There is a lot of stigma about sexual dysfunction in diabetes. I was thinking maybe you were hinting towards this. This is very, very common in diabetics, especially if they are poorly controlled diabetes. Okay, so especially in men, erectile dysfunction is a very common thing, and more than 20% of them are probably acknowledging it. 80% are not. So it's important to bring this up when you have your annual reviews with your doctor. Okay.
Okay.
So it's an important thing, and it's something certainly worth acknowledging, just like the depression side of things.
That can be cured too.
Certainly.
That can be managed.
Absolutely.
Right.
Absolutely.
Thank you so much, Dr. Amit. It was such a great pleasure having the conversation with you, and I'm pretty sure this particular segment is going to generate a lot of awareness and going to solve a lot of apprehensions, clarify the apprehensions that people have related to diabetes. One message that you would want to give to all of our audience, creating and generating awareness about diabetes.
Well, as we mentioned, diabetes is not the end of the world, having this diagnosis. It's something where we can work on, change your lifestyle, work on it, a healthy lifestyle, lose weight, keep yourself active, eat well, eat healthy, and that should kind of keep us going. Okay, so diabetes is not the end of the world. Let's fight it together. Thank you.
Let's fight it together. So guys, I was in conversation with Dr. Amit Varma, and the key messages that you need to take away from this important discussion. Number one, prevention and precaution is certainly better than cure. Early detection plays a dominant role in managing your diabetes. Diet, lifestyle, and health management again plays a very important role in managing and treating your diabetes. And don't forget to be in regular touch with your healthcare team and follow all the guidelines. So this is Anshu Jain, your host for the Candid Talk, signing off for now with the promise that I'll be back again with another interesting episode very soon. Until then, stay safe, stay healthy, and don't forget to subscribe to our YouTube channel, that is Qatar Day, and do follow us on Instagram, Facebook, and Twitter. And for daily news and updates, keep visiting our website, that is qatarday.com. Stay safe, stay healthy. Thank you.